raise taxes on the, quote, middle class, which means people earning $250,000 or less as defined by the White House.
Yeah, I find that very remarkable, Andrea. I mean, for example, the health care plan that the Democratic bills propose will shift to the states so much new cost for Medicaid that in Tennessee it would be at least a 5% new state income tax. And if they also pay doctors to take care of the low-income people they put on Medicaid, it'd be a 10%. The middle class will pay that. And this weekend, Isabel Sawhill, who's in the Clinton administration, many others were saying, in order to pass the Obama agenda, you're going to have to tax the middle class. So I thought the comments yesterday were honest, and I think the comments today are misleading.
Well, they do say that they would eventually save money if the health reform does so-called, bend the curve and bring down inflation, medical inflation, that eventually there will be cost savings.
Well, they say that, but that's not what others say. I mean, the Congressional Budget Office, which the Democratic Congress appointed, said not only will it raise the debt and raise costs in the first 10 years, the costs will go up in the second 10 years. And the Democrat governors have weighed in and said, holy smokes, you can't give us all those new costs for Medicaid because we couldn't possibly pay for those costs. And then there'll be new taxes for employers to pay as middle class people will be shifting out of their employer-based insurance into government-run insurance. So that's what's really going on, and I'm disappointed to hear Mr. Gibbs correct what I thought was the truth yesterday.
Let me ask you about cash for clunkers. What is your position on that? That's a key test of political will in the Senate coming up this week.
I don't know if it's a key test. If it's just a question of whether we have $2 billion free, I'd use it to reduce the debt, if that's the choice.
Well, supposedly it's money that's already been set aside in the stimulus program that has not been used. Would you vote to set that money to put that money into cash for clunkers so that it doesn't run out?
Let me see how it comes before us. Obviously, it would be better spent on cars than on the non-stimulative projects that were in the original bill. But that may not be how it comes to us. When it came to us before, it came as part of the war bill. It just took $1 billion out that could have been used to reduce the debt, and I voted against it.
And what are you hearing from your colleagues? There's talk of a possible filibuster.
I haven't talked with them enough to know. I know among Republicans especially, there's a great deal of concern about the massive debt that we're building up in this country. Too much taxes, too much spending, too much debt. I mean, the idea that we would be spending over the next 10 years, adding more new debt to our country over the next 10 years, nearly 3 times as much as we spent in all of World War II, according to the Washington Post, is mind-boggling, and we have to draw the line wherever we can.
Of course, Senator, the President and the White House would say that so much debt was inherited from the Bush years, the George W. Bush years, and from the Republican-led Congress that piled all that debt up.
They say that about every 5 minutes. Sooner or later, the President and his administration are going to have to take responsibility for their own actions. I mean, their policy seems to be, well, I got in the boat and it was sinking because it had a hole in it, so I'm going to dig another big hole in it. I mean, it wasn't President Bush who recommended that President Obama have budgets that would add as much to the debt over the next 10 years as we spent, 3 times as much as we did on World War II. And it wasn't President Bush who recommended a health care plan that would add $1 trillion to the debt and even more in the next 10 years. So I accept the fact that before the President came in, he had some problems to solve, but he's adding to the problems, so we're trying to help him avoid doing that.
All right, Senator Lamar Alexander from Tennessee, thank you very much. And coming up next, should Democrats move forward on health care without Republicans